Okay, thank you, Tracy. My name is Dominic Peratt, along with Tom Gumpel. I am one of the ISRA NI co-chairs. And I just want to give a brief overview of the NI program. ISRA began the New Investigators Program in 2008 at the World Meeting in Budapest to support the professional development of aggression scholars who are getting started or who are in those early stages of their aggression research career. NIs include enrolled doctoral students, postdoctoral fellows, and early career researchers within 3 years of their terminal graduate degrees. NIs receive partial monetary support to attend the World Meeting, where they participate in a pre-conference workshop and connect with senior aggression scholars at the World Meeting. And the program has evolved over the years to include NI engagement during the 2 years in between the World Meetings. And one wonderful example of this is why we're here today, where we are thrilled to hear research presentations from 3 NIs from our 2024 cohort. For those of you interested to learn more about the program, please see the ISRA webpage, or feel free to contact myself or Tom Gumpel, who are, again, the current NI co-chairs. So I'll turn it over to you, Tom, with our introduction.
Okay, thanks, Dom. Our first speaker is Dr. Travis Harries, and Travis is a lecturer in psychology at Deakin University in Victoria, Australia, and is a member of the Connect Research and Training Initiative within the Center for Social and Early Emotional Development. His research area is family violence, with a specific focus on child-to-parent violence. His research explores the family conditions which predispose and perpetuate child-to-parent violence with an emphasis on dynamic risk factors which can be modified through intervention. Dr. Harry's work has applied focus, and he works closely with clinical services to translate research into practice, understand clinical needs, and evaluate programs for reducing family violence.
Okay, so my program of work is in child-to-parent violence, which definitionally is exactly what it says on the tin. And when I started in this space in around 2018, it was relatively emergent and still is compared to other areas of specific aggression. And so there wasn't much consideration at that time of different subgroups that might exist in the population. And what this led to was a general assumption that all of this child-to-parent violence was the same. It was all adolescent boys seeking power over authority. And I'm going to talk quickly today about some of our studies that begin to show that it's actually probably not all the same, and those differences within the population are likely quite important as well. And to do this, we came at it from a functional perspective, because we theorize that the development of a more proactive and more instrumental, unprovoked use of violence against a parent is particularly interesting and has a lot of implications, given it goes against that standard hierarchy of the relationship and the general size and power differential that you expect and see between parents and their children. And in this way, we suspected that the function or the proactiveness of that violence could look different behaviorally, but also could importantly develop within different family contexts as well. When you compare this to a predominantly reactive function, which could be defensive in response to child abuse or over controlling parenting. That's an oversimplification, but the general rationale. So we wanted to explore the function, as I mentioned, of child-to-parent violence as a means to understand some subgroups in the population, but there was no suitable measures at the time, and we needed something that was parent report, because we had plans to explore a lot of parent-related variables, and we also needed something that was specific to that parent-child dyad. And what existed was one or the other of those things, but not both. So we made one that was fit for purpose. We appropriately called it the Child-to-Parent Violence Function Scale. And I'll just quickly go through some of the validation process and the results, which are from 2 studies down the bottom of the slide there. So our initial item development for that scale followed some standard processes. We reviewed items from existing scales to see what we could adapt. We did a rapid review of themes and quotes from qualitative studies, and then we piloted a draft of those items with 8 or 9 clinical and academic experts to get their feedback. And that initial factor analysis we conducted on a pretty small sample, 121 or 22 Australian parents, but it was a highly representative sample in that all of those families were experiencing substantial and ongoing child-to-parent violence. And what we found was that a three-factor solution seemed to fit the data best. We got some standard reactive and proactive functions that we all know and some of us love, but also this third factor, which included items related to being emotionally conflicted and being fearful of the parent. And this seemed somewhat similar to a type of reactive aggression that's internally or associated with internal frustration as opposed to external provocation. But in our later confirmatory factor analysis, it seems to be more anxiety-based aggression rather than frustration, which makes sense for this population and this type of aggression where there's substantial trauma histories for a lot of these children. Then in a separate study with a slightly larger sample, about 250 parents, we then followed this up with a confirmatory factor analysis, and we found some support for that three-factor solution with a bit of item trimming. This is not a measure of the form in any way. It's just the function. So we use it alongside a measure of the form of child-to-parent violence as well. And so the whole idea for this scale was never to look at individual functions in isolation, because we know that they're highly enmeshed. Even when you look at single incidents, these can have both reactive and proactive qualities seemingly at the same time, which is a little bit inconvenient, but it just means that a more sensible, ecologically valid approach is needed, which is to consider how these functions co-occur at an individual level. And so that's what we did next. We loaded each of these functions into a latent profile analysis, and we found what is on the screen here. So two distinct groups where the primary difference was the ratio of proactive CPV compared to the other functions. And what you're looking at here is that it's the ratio between functions in each of these groups. So we found a group where the child-to-parent violence had proactive qualities that were similar in proportion to the reactive and affective components. We named that our high proactive group, and a group where the proactive aggression was rare, our low proactive group. Both of these groups were reactive, and interestingly, both of these groups were also substantially affective as well. And apologies, those numbers are massively out of context, but they're just the mean scores for a scale that ranges 0 to 4. That high proactive group were a bit more rare, but much more severe or frequent in their use of child-to-parent violence. And so with this, we found that first piece of evidence that there are some meaningful subgroups in this population, at least in terms of the function of the behavior. Within that same study, we then compared these dyads to each other, but also to a control group on a range of different parent and child factors. And I don't have time to go into all the differences and the nuance within each. So I've just highlighted some of the more interesting components of each dyad type here. But generally, what we found was this higher proactive child-to-parent violence seems to correlate with a range of withdrawing, but also power asserting behaviors from the parent, and much higher domineering traits in the young person. So really quite high levels of callous unemotional traits, so impaired guilt and empathy, as well as narcissistic traits and high levels of irritability as well. On the other hand, parents in our low proactive group mainly just rated highly on behaviors related to control. So they were more intrusive or sort of behaviorally controlling than our control group, and had higher levels of monitoring of the child than our high proactive group. And the young person in these low proactive dyads, compared to that high proactive group, were less callous unemotional, less narcissistic, less irritable, but still more than controls. And what we believe this indicates is that child-to-parent violence with that more substantial proactive component, it could develop in a context where there's substantial uncertainty in the environment. There's a parent who's perhaps unpredictable in their caregiving response, and the young person's using aggression to control that otherwise unpredictable response. And there's a lot of adjunct attachment literature which aligns with this conceptualization as well. Whereas in our low proactive group, it seems to feature a parent who's relatively in control, but perhaps over controlling, and the aggression against them could be more defensive or associated with the development of autonomy or striving for autonomy. The main point here, though, is that at the very least, these results show that child-to-parent violence in families is not all the same, and the way in which it's different could be important in that a lot of these factors relate directly to how interventions would intervene with the behaviour. So what's happening now and where we're going next? Well, we continue to work with these functional differences and try to understand the extent of or where the boundaries are for their utility. My research is very applied and translational, so I work closely with a lot of services who deliver interventions for child-to-parent violence. And with them, we're continuing to develop that child-to-parent violence function scale, but for a clinical population where we're looking at proactive child-to-parent violence as an indicator for dropout from intervention, but also slower or lesser gains from intervention as well. And we'll develop some clinical cutoff scores around that too. We're also currently collecting data to understand how individual incidents of child-to-parent violence develop and desist. So, for example, my colleague and I, Dr. Ashley Curtis, we just got ethical approval to conduct in-lab observations of child-to-parent aggression, which we're calling physical and verbal venting, if you're speaking to our IRB. We have a frustration task that was co-designed with our clinical partners where the parent has to get their young child, they're 4 to 8 years old, off an iPad, have them do something far less fun. There's cameras everywhere, including this fancy one on the screen where we capture the first person perspective of the child, and we can track their eye movements and detect fear responses, things like that, provided they keep them on. And we're trying to understand a few things here from these observations, but relevant to this presentation is how situations of child-to-parent violence might look different between our high and low proactive groups that I went through just before. Finally, we have a program of work around substance-involved child-to-parent violence in adolescence, which we're looking to expand to a wider range of addictive behaviours as well. So, for example, we're looking at screen addiction and child-to-parent violence from a cognitive perspective. That's it from me. I'll yield to my new investigator peers.
Yes, so as Tom mentioned, I have for the last month been a postdoctoral fellow at the Norwegian Center for Violence and Traumatic Stress Studies, where I have the honor of running a project more focused on men as victims of violence, because that is a topic with very little focus in society, or at least in Norway. So I'm very excited about that. However, today I will be talking about a project that I did at Virginia Commonwealth University in the Injury and Violence Prevention Lab. And what I will be focusing on today is how executive functioning deficits might moderate the link between callous and emotional traits and gun violence in a sample of youth with a diagnosis of conduct disorder. So this goes very into the specifics in comparison to Travis' project, or overview, I guess I would call it. So I probably don't need to tell you why we need to research gun violence, but it is one of the leading causes of youth death in the United States. And in this study, we will look at youth who are often seen as especially high risk for gun violence, namely youth with conduct disorders and callous and emotional traits. So they tend to show higher levels of aggression, delinquency, and arrest than other youths. So conduct disorder is a DSM-5 diagnosis defined as a persistent pattern of violating the rules of rights of others and breaking social norms. And then we have callous and emotional traits, which is more of a personality feature that lacks empathy, lacks guilt, and has a more shallow affect. And many of the studies on callous and emotional traits have used community samples or mixed clinical samples, and fewer have focused specifically on these youths who have conduct disorders, despite the fact that callous and emotional traits are a part of the diagnostic specifier for limited prosocial emotion. So this study will directly address a subgroup where callous and emotional traits are perhaps more diagnostically relevant. So although these youth are at high risk for violence and gun violence, not all of them will engage in gun violence. Some do and some don't, and this raises the critical question of what makes this difference. Executive functioning is a cluster of cognitive skills. The development of executive functioning is partly dependent on the prefrontal cortex, related to behavior, emotional, and cognitive functioning. This is important because the prefrontal cortex has also been linked to callous and emotional traits, suggesting an overlap between the brain regions that impact callous and emotional traits and executive functioning development. In fact, many kids with disruptive behavior show deficits in these top-down neurocognitive skills, aka executive functioning. So it's not surprising that adolescents with callous and emotional traits and conduct disorder problems or conduct problems show more executive functioning deficits than adolescents with only callous and emotional traits. So why this link? Well, executive functioning includes processes that require goal-directed behavior and self-regulation, and deficits in executive functionings have been linked to aggressive behavior across ages. In fact, a recent meta-analysis by Choi et al. Found that reduced executive functioning was associated with both reactive and proactive aggressive behavior, showing a strong link to aggression. Similarly, a recent meta-analysis found that callous and emotional traits predict both types of aggression, showing a strong link again between callous and emotional traits and both these types of aggression. So this research seems to clearly indicate that executive functioning and callous and emotional traits are linked to both these types of aggression, and they in the broad are connected. However, we don't really know which domains of executive functioning that relates to callous and emotional traits and or aggression. And the research that does exist has produced somewhat inconsistent results regarding which domains these are. In other words, the idea that executive functioning deficits are important and linked to callous and emotional traits and aggression has been established, but there's a lack of there's a lack of and a consistency of research showing that the specifics of the executive functioning functions that are related to these topics. Additionally, I haven't read as of yet of any studies that have linked these aspects to gun violence. And so overall, this delay in identifying the neurocognitive mechanisms that relate to these criminal tendencies and treatment initiatives is needed to be sped up. So, executive functioning has been divided into several different domains. And I know that this is one approach, and there are other approaches to how to classify executive functioning. But we are using the classification used by Berkeley et al., namely divided into 5 different domains. We have self-organization, which is the ability to organize thoughts and actions. We have self-restraint, which covers more this impulse control, response inhibition. We have self-motivation, which relates to goal achievement, work ethics, and efforts. We have self-regulation, which is managing one's own emotion, controlling anger or other outbursts, and having an emotional stability. And then we have self-management of time, which explains more this procrastination or planning and meeting deadlines. So in this study, we examined how these 5 different domains of executive functioning moderated the relationship between callous and emotional traits and both reactive and proactive gun violence. So reactive, I don't feel like I need to explain that to this group, but it's a hot-headed, impulsive behavior. And then we have proactive aggression, which is this cold-blooded, planned type of behavior. So to do this analysis, we use the inventory of callous and emotional traits, a self-report to measure the youth's callous and emotional traits. We use the Berkeley Deficits in Executive Functioning Scale, which is a caregiver report to assess executive functionings. And then we use the Gun Violence Questionnaire, which is a self-report created in our lab to measure reactive and proactive gun violence. So an example of the reactive is I shoot a gun at others when I feel threatened. And an example of the proactive is I use a gun to get others to do what I want. So this follows the exact same pattern as the RPQ, which you're probably all familiar with from the aggression literature. So this study included 219 youth with conduct disorders. They are between the ages 13 and 17, and they are primarily boys, which is consistent with the literature on conduct disorder. So we did a stepwise regression, and as you can see, both steps were significant, and callous and emotional traits predicted aggression in the first steps of both these models, meaning that callous and emotional traits predicted both reactive and proactive aggression, which is consistent with the literature. Additionally, there was an interaction between callous and emotional traits and self-restraints in both these second step models, meaning that lack of impulse control and self inhibitory control is an expands the power here. So if we go into these plots, you can see that youth with higher callous and emotional traits and more deficits and self-restraint show more reactive gun violence, while those with high self-restraint show lower reactive gun violence. And the same was true for proactive gun violence, seeing that lower or deficits in self-restraints increase proactive aggression. So this is kind of opposite thinking because higher score means more deficits instead of better achievement or better executive functioning. So why is this study important? Why do we need to look at this and talk about this? Well, many studies have lumped all these executive functioning subscales into a single executive functioning total scores, which obscures which specific aspects that actually matters when it comes to executive functionings. And these findings are generalizable to a real-world setting where we have in the juvenile justice system, in psychiatric clinics, or in violent intervention programs where youth with conduct disorders are most often seen. By showing that a self-restraint stands out among these executive functionings, the findings help differentiate which facets of executive functionings that are actually functionally relevant to gun violence and maybe also violence more broadly in youth with callous and emotional traits. So if self-restraint is a key moderator, then maybe targeting behavioral inhibition through impulse control training, cognitive behavioral therapy, mindfulness, or structural behavioral programs may be an efficient way to reduce gun violence, and then also maybe other types of aggression and violence in this population. So knowing that callous and emotional traits combined with lower self-restraint relates to gun violence allows us to have a better risk assessment and treating options for youth with conduct disorder. So in short, improving behavioral inhibition may reduce gun violence among this high-risk youth population. And thank you for listening. And as a segue from this, I just want to put out there that I will be doing a meta-analysis on how callous and emotional traits and psychopathy relates to executive functioning. So if you have any work, please send it my way. Thank you.
Yeah, basically, I want to give you a very brief recap of my PhD research with a focus on the most recent findings. But yeah, to give everyone a bit of background info, I will repeat some of the things I already mentioned in Munich last year, but I don't think anyone who was there is here today, or if so, you might not remember what I presented back then. Also, as a disclaimer in the beginning, everything I mentioned is based on data from young heterosexual men aged 18 to 25. So it all started with the realization that we know a lot about risk factors, but very little about what can decrease the risk of sexual aggression, other than like removing risk factors. On the left-hand side, you see a list of examples of risk factors, such as peer norms on the relationship level and family violence as a static risk factor. We also know that rape myth acceptance and sexist attitudes are strong predictors of sexual aggression. On the protector side, however, there's very little, especially on the individual level. We know that empathy can act as a buffer for the risk factors and that positive consent attitudes are important. And yeah, even though much of the risk research focuses on attitudes towards women and sexuality, because yeah, they are important predictors, there's basically nothing about positive attitudes towards women and sexual relationships or helpful, unproblematic beliefs about rape that counter common misconceptions. So we wondered, what attitudes can we actually promote? Because it doesn't usually work well to tell people you should stop thinking like that. So yeah, I think it's important to provide alternatives that can replace the unhelpful or harmful attitudes. So the question was, what attitudes do those people hold that are very unlikely to perpetrate rape? Or in other words, what attitudes may function as a protective factor? And since there's little to no research on this, we first had to identify these attitudes and develop a scale to be able to measure them. And first, I should mention that we follow the definition of rape as defined in the Istanbul Convention on Preventing and Combating Violence Against Women, which identifies rape as any non-consensual penetration of a sexual nature of the body. And consent is considered absent if it's not given voluntarily or if the person is unable to form a free will due to physical or mental condition, such as in a state of unconsciousness, intoxication, sleep, illness, injury, or disability. It also highlights that consent can be withdrawn at any moment and that silence, verbal or physical non-resistance or past sexual conduct is not the same as giving consent. So we started the scale development procedure with a qualitative part for item generation and content validation. So we went on websites like these to get like rape myth debunking statements, gathered them together, and then together with 5 experts who added and edited these statements, we went through 3 feedback rounds. So they added more items. I collected the feedback, I sent it back. They gave another round of feedback until we had a list of 60 items. Then there was some more rounds of adjusting them. And then with a list of 44 items, I did cognitive interviews with 10 male students. Cognitive interviews mean that they go through the scale and still indicate their agreement on a Likert scale of 1 to 7. But while doing that, they also verbalize their thinking process. And that's just a very good way to see where they might be misunderstanding something, how they understand something, to see whether they all understand it similarly. And it was also just very interesting to see how they get to their ratings. And this item list then went through 4 quantitative studies to reach a scale with at most 20 items that is internally consistent and correlated with related constructs. And here you see some of the final 19 items. For example, some women do not resist unwanted sexual activity because they freeze, or usually women are raped by someone close to them, or the only one to blame for rape is the perpetrator. Then, yeah, what did we do with this? We wanted to see how risk and protective factors relate to victim blame, distorted perceptions of consent, and rape proclivity, and whether the addition of protective factors to risk factors as predictors meaningfully improves the prediction of these outcomes. So we took the protective factors previously identified, plus the new anti-rape attitudes, and the risk factors from the confidence model. case you're not familiar with the confluence model, it is probably the most used model in research on sexual aggression in men in the general population. And it identifies two pathways related to sexual aggression: impersonal sex and hostile masculinity. The impersonal sex pathway refers to a preference for casual, non-committed sex, and is therefore characterized by having more sexual partners and engaging in more casual sexual relationships, which can then lead to emotional detachment in sexual interactions, and that can result in less concern for the partner's well-being, or simply not knowing very well how the partner reacts because you don't know the partner well, which can in turn lead to a higher risk of sexual aggression. Hostile masculinity, on the other hand, is refers to attitudes and personality traits that reflect a defensive and distrustful attitude toward women. And we operationalized it as is done in many studies with the hostile sexism subscale of the ambivalent sexism inventory and a rape myth acceptance scale. Here we used a modern, more subtle rape myth acceptance scale that also includes adversarial sexual beliefs, which is one of the core components of hostile masculinity. And as you can see in this table, the protective factors and the risk factors are negatively correlated with each other, except for at the bottom, impersonal sex, which is a bit more independent. And also you can see that rape myth acceptance and hostile sexism are very highly correlated. And actually it loaded onto the same factor, these two scales, which was more of a reason to take them together. And then one of the outcomes we wanted to study was rape proclivity, which describes a self-reported likelihood to rape if assured of not being caught. And Malamuth back in 1981 found that up to 35% of college participants reported some rape proclivity when asked directly. So really asked, how likely would you be to rape someone if you could be sure that no one would ever find out? But yeah, asking so directly is of course related to potential social desirability biases. And to mitigate this risk, scenario-based rape proclivity measures were developed. Here, participants indicate their likelihood of behaving like a character in a hypothetical scenario, and the character shows sexually aggressive behavior without the term rape being explicitly mentioned in the scenario. And these rape vignettes, as they are also called, also allow to systematically change certain conditions, such as the victim-perpetrator relationship, or for example, alcohol being present or not, while keeping others controlled, which of course is not possible in a real-life scenario. So we did that for 4 different relationship types, and here you see the date scenario as an example, which read, your friends mentioned that a mutual acquaintance has feelings for you. Since you also find her attractive, you decide to ask her out. The two of you have a great evening, and when you walk her home, she invites you in for a coffee. Once inside, you start kissing her and caressing her legs. She pulls away slightly and laughs nervously, but you're convinced that she's interested and just needs a little more encouragement. You guide her toward the bedroom, but she hesitates, saying things are moving a bit too fast. You brush it off, telling her you're both adults. You make another move, and though she initially pushes back, she doesn't resist much when you continue until you eventually have sex. So all the 4 scenarios were similar. It was with a partner, a party acquaintance, the date, and the stranger, and they all just ended in this vague phrasing, eventually you have sex. After each vignette, participants indicated their agreement with 6 statements on a 7-point Likert scale. And for rape proclivity, these read, I might behave as described in the situation, or I would somewhat enjoy getting my way as described in the situation. And linking this back to the predictors, here you see the summary of hierarchical linear regression analyses, more specifically the second step where protective factors were added. And hostile masculinity emerged here as the strongest risk factor in all the known perpetrator scenarios, even though impersonal sex also predicted higher rape proclivity. And anti-rape attitudes were only significant in the party scenario, and positive consent attitudes and empathy only in the stranger scenario. Then the other items served to measure victim blame and a distorted perception of consent. And for victim blame, we asked for their agreement on the statements, the woman was responsible for the outcome of the situation, or the man was responsible for the outcome of the situation, which was then reverse coded to put them together. And for a distorted perception of consent, participants indicated their agreement on the statements the sexual activity was consensual, or the woman in the story eventually enjoyed the sexual activity. And for the regression outputs, here you see that in-person sex is less relevant and anti-rape attitudes more relevant. It predicted higher victim blame across all scenarios and higher levels of distorted consent perception in the partner and party scenario. Whereas positive consent attitudes were not significant, and empathy, again, only in the stranger scenario. And also, overall, adding protective factors always explains significantly more variance than risk factors alone. So across all outcomes, across all relationship types. But how could all these factors work together? Because typically, victim blame and consent perceptions are either studied as outcomes of some of these or similar predictors, or as predictors of rape proclivity or sexual aggression, but not together in one model. So we hypothesized that who you think is responsible for the situation influences whether you think it was consensual or enjoyable, which ultimately affects whether you would say you might behave similarly. And we tested the serial mediation model where victim blame was the first mediator and distorted consent perceptions the second mediator using path analysis. And got this, again, the date scenario as an example, and we found support for this hypothesis in our data. The relationship of risk and protective factors with rape proclivity was mediated by victim blame and distorted perceptions of consent. But of course, it's important to keep in mind that the order of mediators in our model was based on literature and theoretical reasoning and tested with a cross-sectional design, so no claims about causality here. Other explanations are also possible and plausible. For instance, participants who said they would have enjoyed getting their way as described in this scenario might have interpreted the situation as consensual or blamed the victim as a way of justifying their reaction, so a sort of post-rationalization. And since I still have a minute, I also want to briefly show you what we did with these anti-rape attitudes in experimental studies. We namely used the repetition-based truth effect to promote anti-rape attitudes. The truth effect states that the perceived credibility of a statement increases if the statement is already familiar. And we tested this with the anti-rape attitudes in 3 experiments that followed the typical truth effect procedure comprised of 3 phases. In the familiarization phase, half of the statements are shown together with the same amount of irrelevant statements. So we showed half of the items of the anti-rape attitude scale with the items of the pet attitude scale. Then there was a brief distraction phase, and in the test phase, participants simply completed the entire anti-rape attitude scale, and half of the items were familiar and half of the items were new. And we could see a small but significant difference in that repeated items were agreed with a bit more than the new items. So even though the second study was not significant, there was still a slightly higher mean score. And then we ran an internal meta-analysis to see how the overall effect is. And yeah, the effect is rather small, but yeah, that's not surprising because evaluating such statements will be influenced by many pre-existing beliefs and not just the repetition, because usually the truth effect is studied with trivia statements. And also the difference between new and repeated statements might be rather small because they come from the same scale and measuring one construct, so they're very similar. But the fact that only one repetition had any effect is already quite cool, in my opinion. And yeah, I linked the papers here in case anyone wants to read even more about fact analyses or more about the study, and the findings on the mediation analysis and the regressions. Linking everything together are just submitted, so no paper on that yet.